Hi, this is Dr. John Day with another episode of Get Your Life Back in Rhythm with cardiologist Dr. John Day, and that's me. Here, my goal is to try to help you optimize for longevity, cardiac performance, and normal rhythm. You can find the blog version of the message today, a podcast version, YouTube version, whatever works best for you. Also, be sure to sign up for my newsletter at my website at drjohnday.com. There I compile everything we've done for the last month so that you won't miss a thing. And so with that, why don't we jump into today's topic? Is fish oil good for the heart? So let me give you 6 reasons why I've taken fish oil. And then at the end of this podcast or video, however you're viewing it or listening to it, I'm going to answer that question if I'm still taking it. So stay tuned. So 6 reasons why I've taken fish oil. Number 1, it may help my blood pressure. And in fact, this study showed that with fish oil, that you can lower your blood pressure about 1 to 2 points. Now that's pretty minimal. You could lower your blood pressure 1 to 2 points just by losing 2 to 4 pounds. With the typical blood pressure medicine, you can lower your blood pressure about 8 points. But anyway, taking fish oil may, according to this study, reduce your blood pressure 1 to 2 points. So that's reason number 1. Number 2, triglyceride lowering. It has been well known for decades that fish oil is actually really quite good at lowering your triglycerides, and that's the fat that circulates in your blood. Now, why do you want to keep it low? You want to keep it low because it can help to decrease your risk of heart disease or many other cardiovascular problems. Now, even though fish oil does lower your triglycerides, at least in my experience, I can lower my triglycerides even more by cutting out all added sugars and getting rid of all flour. I can drop it even more. Number 3, as far as reasons why I've taken fish oil in the past, it's a powerful anti-inflammatory agent. And there are a number of studies which have looked at, is keeping your inflammations low? Could that be a possible secret to not immortality, of course, but to a long, healthy life? You want to keep the inflammation levels as low as possible. Now, of course, you may get an illness or something along the line. Maybe you get a viral illness, and that may spike your inflammatory markers. But long-term, you want to keep your inflammatory markers in the blood, your biomarkers, as well as overall inflammation levels as low as possible. Reason number 4, I suffer from dry skin and dry eyes. I am a contact lens wearer and have been for decades and decades. I live in Utah, which is a very dry climate. And I've noticed now that I've gotten into my 50s, I didn't have this problem before, but now that I've gotten into my 50s, I get dry eyes, and it makes it hard to wear contact lenses. And so there are some data that fish oil can help to keep your skin moisturized, and it can help to avoid the dry eye syndrome. So that was another reason why I took fish oil. Reason number 5, there's some data that taking fish oil may help with weight control. Sadly, I have 2 copies of the fat gene, and looking at patients or people with the fat gene, there's about a 90% chance you're overweight if you have 2 copies of the fat gene, and I got them both. I used to be overweight, and I've struggled every day at maintaining my 30-pound weight loss. I've had to record every bite of food I've had for the last decade. Otherwise, I've tried stopping 3 times, and I'll gain 10 pounds in a month. And right now, I'm still got a couple pounds more to go to get back to my target weight. It is something I've struggled with my whole life. And there's some data that fish oil can help with weight control. And so for me, wanting to maintain that very lean body weight, because I know it's the best for longevity and cardiovascular disease prevention, it's been a struggle. Now, whether it helps me or not, hard to say, but there are some data, like you can see in this study, randomized trial of weight loss diets for young adults varying in fish and fish oil content. And in this study, they showed that both fish oil and fish can help with weight control. Reason number 6, it may increase my longevity. Now, the data as far as longevity in taking fish oil is very weak, so you cannot recommend it based on this. But here was a study published about a decade ago, association of marine omega-3 fatty acid levels with telomeric aging in patients with coronary heart disease. As you know, the telomeres, they're like the tips of your shoelaces. The shorter the telomeres get, the more likely you are to suffer from chronic diseases and an early death. So you want to keep your telomeres as long as possible. At least in this study, they showed that the higher your omega-3 levels are, the slower the aging process, the longer your telomeres. Once again, the data is really weak on this, but it's something that did intrigue me. So now, with that in mind, I've given you 6 reasons why I've taken fish oil in the past. Let's talk about the latest data on fish oil, heart disease, cancer, and atrial fibrillation. Does it still make sense for me to take fish oil? This was published a couple of years ago in the New England Journal of Medicine, which is the most prestigious medical journal in the world. Title is Marine N3 Fatty Acids and Prevention of Cardiovascular Disease and Cancer, published on January 3rd, 2019. It's called the VITAL trial. And as for those of you who have read my blog, listened to my podcast, the cool thing about cardiology is all of our trials are an acronym. And the acronym usually is pretty cleverly thought out, and this one is no different. This is called the VITAL trial. In the VITAL trial is a randomized controlled trial, which is the highest data. You can place a lot of faith in randomized controlled trials. They had nearly 26,000 patients. They were randomized to approximately 1 gram daily of fish oil or a placebo, followed for over 5 years. And the question was, if you take basically a gram of fish oil a day, can you prevent cancer? Can you prevent cardiovascular disease? So what did they find? Well, this is looking at invasive cancer type, any cancer. And if you look at the curves, here you are over time, 0, 1, 2, 3, 4, 5, 6 years of follow-up. You look at the curves and there really is no difference between placebo and taking a gram a day of fish oil. So what does this tell us? Basically, in this randomized controlled trial, nearly 26,000 patients, and this is about as solid as evidence as you can get. The bottom line, fish oil did not prevent cancer. Next, looking at major cardiovascular events. We're talking like heart attack, stroke, death. If you look at major cardiovascular events, there really was no statistical difference between taking a gram a day of fish oil or a placebo. Once again, very high numbers of patients, no protection seen from fish oil. What about atrial fibrillation? And this was just recently published. It was published on March 16th of this year, 2021. The effect of marine omega-3 fatty acid and vitamin D supplementation on incident atrial fibrillation, a randomized clinical trial. So once again, randomized controlled trial, highest level of evidence, over 25,000 patients, nearly a gram a day of fish oil, followed for 5.3 years. Does fish oil prevent atrial fibrillation? In fact, the answer, at least in this study, no. If anything, there was a signal, a trend. It did not reach statistical significance, but there was a trend toward an increased risk. So that's an increased risk of atrial fibrillation if you supplement with a gram a day of fish oil. That's really quite alarming. And so it really brings up the question, does fish oil cause AFib or atrial fibrillation? As I mentioned, in the VITAL trial, there was a non-significant increased risk of taking a gram per day. In the OMINI trial, where they had 2 grams per day of fish oil, once again, a non-significant risk. What do I mean by non-significant risk? It means there was a trend toward an increased risk of atrial fibrillation from fish oil, but it didn't quite reach statistical significance, so we can't say for sure. However, in the REDUCE IT trial, where they used 4 grams per day of fish oil, or the STRENGTH trial, 4 grams per day of fish oil, they did see a statistically significant increased risk of atrial fibrillation from taking fish oil. And so that really raises the question, is there a dose-related effect of fish oil to atrial fibrillation? This is something for me as primarily an atrial fibrillation doctor, seeing these studies, seeing that fish oil could possibly be a risk factor for atrial fibrillation is something that is really quite alarming to me. Also, and I bring this up because there's a lot of controversy in the medical literature. This is something you need to ask your own cardiologist or cardiac electrophysiologist or EP about. What about the bleeding risk for those on blood thinners if you're going to add fish oil into the mix? There are some data that say if you add fish oil to a blood thinner, say like warfarin, then your risk of bleeding goes way up. There are other studies like this one here, fish oils and bleeding. Where is the evidence? Where it argues that fish oil does not increase your risk of bleeding. This is something that you definitely need to discuss with your cardiologist or your cardiac electrophysiologist, because if you are already prescribed a blood thinner, whatever that may be, and then adding fish oil, are you doubling your risk? So once again, the medical literature goes both ways. Hard to know really where the risk lies with this, but be sure to discuss with your physician if you're on fish oil, you're thinking about fish oil, and you're also on a blood thinner. So I told you I wouldn't leave you hanging. The question is Dr. Day still taking fish oil? So let me tell you where I am at today. And this could change over time. If it does, I will try to let you know. But it may not be. It may be a few years before I tackle the subject of fish oil again. So this is just me. Do not take this as advice. This is something you need to discuss with your own doctor, but here's what I am doing. Before I get into it, my 4 rules for supplements. Number 1, I buy all of my supplements online through Amazon, mainly because I don't have the time to go shopping, and it's very convenient for me. I buy supplements that have high ratings and low returns, basically the Amazon choice. Now, I know that high ratings can be gamed. Manufacturers can practice unethical techniques to get more positive ratings, but as far as low returns, I think that's fairly legit. How many people are returning their, in this case, fish oil back to Amazon? That's something that Amazon can monitor. If that brand of fish oil was killing patients, then presumably they would either be getting their fish oil returned by their next of kin or bad ratings. So I know it's not a very accurate way, but given that supplements are just totally unregulated and you're at the mercy of the manufacturers, for me, this is just one more added layer. So I only buy Amazon choice for supplements. Number 2, I only take a half. Whatever it says on the bottle, I only take a half because once again, I don't trust supplements and I don't trust the recommended dosage. That's for low-risk supplements. If I view it as a high-risk supplement, then I only take a quarter of the dose because I want to really reduce the risk. And it's got to be a really compelling reason for me to take what I consider to be a high-risk supplement. As with everything, discuss it with your physician because there are risks with taking anything. And if you haven't found out what the risks are, then you haven't taken it long enough. There are risks to everything. So I also cannot give a recommendation on what specific brand I take. I do not want to invite any lawsuits or anything. And based on the data that I just presented to you, I have now moved fish oil from what I previously felt was a low-risk supplement to a high-risk supplement. Some of that could be a bias since I am an atrial fibrillation cardiologist specializing in atrial fibrillation treatment, but I now put fish oil in the high-risk supplement category. So what am I doing? Well, I'm currently taking a quarter dose of fish oil, which based on what the specific supplement, Amazon choice fish oil supplement that I'm taking, it means I'm taking a half a gram per day. So hopefully at a half a gram per day, I am not putting myself at risk for atrial fibrillation. I do eat flax and chia seeds every day, which is a plant-based version of getting omega-3s. I occasionally eat wild salmon. Wild caught is very important because you don't want to put yourself at risk of mercury toxicity or PCB toxicity. I only eat salmon maybe once a month, so I'm not getting a whole lot of fish oil there. Right now, I am undecided. I had a big stockpile of my fish oil. I'm now down to my last bottle. I'm a little unsure if I'm going to renew it or I'm just going to drop it and try to boost the dose of flax seeds and chia seeds that I'm taking every day. For flax and chia seeds, I eat the real seed. The real whole seed. So I'm not taking any supplements when it comes to that. So that's where I am at. So let's bring it all together. What are my 5 thoughts on fish oil for the heart? Number 1, fish oil may help to reduce your triglycerides, which can help prevent cardiovascular disease. It may have an ever so slight reduction in blood pressure, and it may reduce inflammation levels. However, despite all of these good benefits, in the VITAL trial, it didn't prevent major cardiovascular complications. So something's missing. There's so much, it's so hard. You can find a study that almost says anything. But a large randomized controlled trial like the VITAL trial of nearly 26,000 patients published in the most prestigious medical journal on this planet, that's about the highest level of evidence that you can get. Number 2, there is very, very, very weak data as far as the role of fish oil for healthy weight maintenance and longevity. Some suggestions that it may help, but it's really weak data. So I at best, take it with a grain of salt. Number 3, based on the VITAL trial, taking a fish oil supplement probably won't prevent heart disease and probably won't prevent cancer for you. Number 4, it may increase your risk of atrial fibrillation, and that may be a dose-related effect. I'm taking right now 0.5 gram per day. Whether I'm still taking that in a month or not when my bottle wears out, I don't know. I really don't know. I'm still worried about this point. Certainly taking 4 grams per day of fish oil seems to, at least in 2 studies that we talked about here today, may increase your risk of atrial fibrillation. Number 5, it might just be that getting your omega-3s naturally from fish, if it is a low mercury fish, low PCB fish, or getting it from plant-based sources of omega-3 like flax seeds or chia seeds. I eat flax seeds and chia seeds every day without fail. And if I am going to drop that fish oil supplement, I need to bump that up. Salmon, as I mentioned, it's still about a once-a-month thing for me. I could probably do better, but fish isn't my favorite food, so it's hard to force myself to eat it. Anyway, thank you so much for tuning in to our discussion today on fish oil and whether it prevents heart disease or not. Is it good for the heart? And I'll leave that to you to decide after all of the data we discussed today. Just want to remind you that if you want to meet with me individually or one of the other cardiologists in our clinic, we have one-day access to world-class cardiovascular care. Just call our clinic at 801-266-3418. Unfortunately, we're only able to offer in-person visits, and we're located in Salt Lake City, Utah. I wish I could answer all of your online questions, participate in the comments sections, but I just can't. I've got too much on my plate. I'm trying to be a good husband. I'm trying to be a good father. I'm trying to exercise every day and eat right every day, and that requires dedication and time so that I can practice what I preach, as you've hopefully read in my books, The Longevity Plan or The AFib Cure, both of which have been bestsellers on Amazon. Please visit my website, drjohnday.com, sign up for my newsletter, and please, if you found this helpful, share with your friends, your coworkers, or anybody else you know. Thank you so much, and I will see you next time.